Hello, I'm Dr. Max from Hair by Dr. Max Restoration Center in Fort Lauderdale. I want to discuss female pattern hair loss. Though both men and women suffer from hair loss, unlike male pattern baldness, we don't know what necessarily causes female pattern baldness. As far as the time at which women may lose hair, the range in age is similar to men. It can occur as early as after puberty or begin much later in life when they enter menopause. To classify female pattern hair loss, we use classification scale known as Ludwig scale. In postmenopausal women, hair may begin to miniaturize over the entire head, thereby losing original volume and become difficult to style. Aside of AGA or androgenetic alopecia, genetics can be a causative factor. Health issues such as iron deficiency or hormonal imbalance that arise from pregnancy, menopause, or withdrawal of oral contraceptives or hysterectomy can also spur hair loss in women. Other causes for hair loss in women can include extreme stress, side effects from medications, traction hair loss, burn or major surgery scars, and also autoimmune conditions such as LPP, CCCA, or frontal fibrosing alopecia. Due to its variety of causes, hair loss in women should never be assumed to be androgenetic alopecia. Examination and diagnosis by a physician, endocrinologist, dermatologist, or hair restoration doctor are essential before any hair transplant is undertaken. It is best to have your doctor or hair loss specialist determine what causing your hair loss that you may have experienced. Female pattern hair loss or androgenetic alopecia is the most prevalent form of hair loss affecting women. Unlike men who typically experience receding hairline, women often notice a gradual thinning in the crown, widening as the teenage years or develop later in life, frequently becoming more apparent post-menopause. While the exact etiology remains unclear, several factors contribute to female pattern hair loss. These include genetic predisposition, hormonal fluctuations, and natural aging process, which can lead to hair follicle shrinkage. If you are experiencing hair loss, consulting dermatology or hair specialist is crucial. The diagnostic process typically involves thorough scalp examination, a comprehensive review of your medical history, trichoscopy analysis, and potential blood tests to exclude other underlying conditions. Several treatment options are available for female pattern hair loss. Minoxidil can decelerate hair loss and stimulate regrowth. Your physician may suggest prescription drugs like spironolactone or finasteride. Low-level light therapy is an emerging treatment with research indicating its potential in promoting hair growth. PRP or platelet-rich plasma treatments offer an innovative approach involving injection of your own blood plasma into the scalp. For advanced cases, hair transplantation can yield effective results as a surgical intervention. And other modalities, one of the newest is Folix, which is a non-ablative fractional laser, can stimulate hair regrowth as well. Understanding and addressing female pattern hair loss can be a complex journey. If you have any questions or concerns about your hair health, don't hesitate to reach out to us at Hair by Dr. Max Restoration Center. Our team of specialists is here to provide personalized guidance and cutting-edge solutions tailored specifically to your unique needs.